Okay, number 6, 100% symptomatic relief from antibacterials is not expected in the two-thirds who are chronic. What we expect and get most of the time is 80 to 90% symptom relief. That's my goal is 90% after several rounds of treatment. However, the diet and other symptomatic treatments can boost to 100% symptom relief. So this is really an important point for patients to understand because it's a tricky one to communicate. The problem is that patients think about their past experiences with pharmaceutical antibiotics and they expect their symptoms are going to be like that. They're going to be 100% gone at the end of treatment. And so what they may do is report to you that the treatment didn't work when they're 80% better or when they're 90% better. They'll say, it didn't work because they have 10% of symptoms remaining. And the reason for this is the remaining underlying cause, which continues to cause SIBO relapses and make SIBO chronic. That underlying cause has symptoms of its own. These are conditions and diseases of their own. So even if the SIBO is cleared, eradicated, and it's gone for some time, there's still the primary condition there. And, these are obviously affecting the GI, so they can cause GI symptoms, all these various underlying causes. And then, of course, once the SIBO does begin to relapse and return, symptoms also will begin to return. This is important to understand for us, especially so you don't think that you're doing something wrong if your patient still has some little bit of symptoms remaining when they're a chronic case, like 10% of symptoms. So I showed you before on the algorithm, my goal is 90%. I can just quickly show you again where that lives. Right down here on the bottom left, the goal is for someone to be better 90% or more better. So that's it. And you can see here, I don't typically retest. Retesting I only have on this right hand side when they're not better. If they're better, we've achieved our goal. I don't need to prove that the SIBO's gone. In fact, you can get into a little trouble there because I don't know, what if the test still shows it's positive? I don't want to treat a test. I want to treat the person. If they're better, I don't typically do any more treatment if like they're better. So, but patients will obsess over it. I bet you some of you have encountered this, and then they'll just want more and more antibacterials when they really have like no symptoms left. So that's why I don't tend to test when their symptoms are gone.